And like, yeah.
All right. Hey, everybody. Thanks for coming to the second part of the headache migraine protocol. This will be a small class. I usually do not teach classes to groups less than three, but extenuating circumstances happen. So we're going to breeze through this today. It's not going to take very long at all. We'll probably be here for about an hour instead of 90 minutes to 2 hours. I will ask that once I get started, hold your thoughts and your questions until I give you the blocks to do it in so that my brain doesn't break. And then let's get right into self-care tools. The first one, the biggest one that I always show is the straw. You can buy these separately now. You don't have to buy the whole water bottle. I have an old design, so I can't put mine in the water bottle. But this helps with tongue posture and tongue strengthening. That way, your tongue is holding up your jaw, not your jaw muscles, which seems counterintuitive, but your tongue is actually one of your jaw muscles. And it's a very important muscle for balancing your upper cervical as well. And that's there are videos on how to do this and there are diagrams that can show you. I'll try to find a couple that explain this better. Um, I'll try to find the website too. I always call it the remastered sleep water bottle, but I think it's like a different one. So, um, yeah. The next one is wait, let me back up. So the straw you would use off and on throughout the day. There'll usually be instructions on the website on how to use it. And then if you have a dentist or a myofunctional therapist, they'll be able to give you more details on how to use that. Uh, but I use mine more often when I'm starting to wake up with my mouth open in the middle of the night and my tongue is all dried out because I started mouth breathing. So part of the process of this is to help you keep your mouth closed while you're sleeping because your tongue will be on suction in the proper position at the roof of your mouth and allow air to go through your nose. The next one is playing playing hockey with ice. So this is a suggestion I made at the last class I taught. So when you're having a lot of like inside pain, and if it's like more nervy or inflamed, or you've got some isolated swelling occasionally, that can happen with irritation at the trigeminal nerve branch. And so if you take a small ice cube, you can find different ice cube trays. And I'll have one in the email, but like a little ice ball, and you put it in your mouth and just sort of move it between your cheeks. You don't want to like let it melt inside your cheek. You know, like when you chew or suck on ice chips, it's always moving around inside your mouth. That's what you should be doing. And then you can just crunch it up, eat it, chew it whenever you feel like you want to. But by kind of like, you know, tucking it into your cheeks and moving it around, you're gonna numb up the inside area. And then when it's tucked in your cheek, between your molars and your cheek, um, it's gonna help a lot with the where the nerve starts to come out, and it'll start to numb that up. So that could be something that's helpful, especially if you have some like gum pain and you don't want to use or you can't use things like Orajel. Uh, Ice that's rapidly melting inside of your mouth could be a very helpful tool. The same thing, the same principle applies on the outside, but instead of using ice, you can use a gel face mask. I pulled this out in the last class. It's got the holes in it. Put it on your face for like 5 to 10 minutes. It'll be cool. It'll help distract and help calm down inflammation in the skin and help tighten the skin and give you a cooling, comforting sensation. It's another one of the self-care tools. That would be great. going back from the last class as well, even though it's an outside technique, that still point inducer, the camel hump thing that I showed, is going to be helpful for the back of the jaw and the upper cervical. And it could be part of your regimen for handling a migraine before you go inside with gloves. My particular protocol method for me when I have like really bad headaches and I know it's coming from up here and here is to do stuff with the back of my head first, to loosen up my scalp first, to do the outside stuff first, and maybe even apply ice to the back of my neck. That way things are settled, less irritated when I do go inside. You can do it either way though. And what I like to tell people is that it's up to you. These are your tools. These are your things that you can do when you want to do them and how you want to do them. It's highly experimental to find the combination that works for you. And you'll know, like if your pain feels a certain way, you might know, oh, that means that I need to put something cold on my neck. Or, oh, that means I need to like pull my ear out. Or, oh, that means that I need to actually just go right in with the gloves, like right now. Like you'll know what that's like as time goes on with practice on how to do this. Any questions about recap from the self-care tools from the last class and this class before I move on? Okay. So let's recap some of the outside techniques that are important for this. So if we remember how to pull our ear out, pull our ear out. And then we remember how to find the jaw muscles, the masseter and buccinator, and how to grab and scoop up the tissue and hold. And then same side, we find where that muscle is. On me, the muscle bellies is like 2 or 3 fingers wide. And come down to the edge here and swoop up. Always slide out with respect. And you can, if it's really bothering you and you don't want to go inside your mouth, you can take your fingers and you can actually grind into the muscle a little bit if you want. I don't find it helpful to do that right away. I feel like that first layer of tension has to be released first. And then also what I'm noticing too is when I do it, if I'm not careful, I hit the nerve and I have that sour sensation in my mouth, you know, where you tingle, you have something sour. So if you feel that, you're like on the gland, you're on the edge of the gland back there, or you're on like the nerve itself and you need to readjust your positioning. So that's how you can work that up a little bit. You can even kind of come up into the bone a little bit to work the attachment point. Make sure your fingers are braced. that. I know, it already feels a little bit better. For me, it's tender. It's a little painful, but it does feel better. So always go within your tolerance. Don't try to push through pain though. Don't try to cause yourself pain. That's not the point of this exercise. My cheeks feel looser. I have like all this tension here though. That's okay because there's a technique for that on the inside. Before I move on to gloves, is there any outside techniques that you want me to revisit before we go to the next part? Okay, yeah, class will go really fast because there's only two of us. And you've already taken the first part. That's okay. So, if you have your gloves, please put them on. And then I'll explain how this works before you start touching your mouths. Oh, wait, I forgot to do something. Hold on, where is it? If you have any finger braces or anything, you want to put those on. So for me, I have a very specific problem with my joint, and I have to wear this so that I can grip and apply pressure. They say a thumb injury is the end of a life for a massage therapist, and I disagree. There's so many ways to work around it. I say the only massage therapist that works with one of these on too. I don't see anybody else talking about it. A lot of people would be like, oh, you should just quit your career at that point. I'm like, no, I don't have to. We can make this work. We have no choice. We have to keep going. Okay. So you have wet and dry fingers. Your wet fingers are thumb, pinky, and middle finger. If the middle finger doesn't work, then you can make it your ring finger. But, oh wait, no, it's your ring finger, sorry. It's your ring finger, but if it doesn't work, it can be your middle finger. These two are predominantly dry, but there are situations where, depending on what you're doing, you might want to use that. Just in today's pandemic filled world, you want to make sure that your surfaces are clean and your face is clean. If you're going to be doing this, change gloves if you need to use dry fingers, what I would prefer people do. Or use hand sanitizer or something and make sure it's dried really well. Or alcohol sprays prefer to refresh your gloves for if you're switching, because then you won't have residue from the hand sanitizer. That's another option. But essentially what we're going to do, I'll start on this side because it's bothering me, is the thumb is going to go inside the cheek and it's going to land on the inside of the mouth where that hinge is. So it's gonna look like this. Uh, then these fingers are going to be on the outside. See how I'm kind of angling downwards, and I'm going to scoop up the tissue and I'm going to lift it up. I'm not going to start grinding or massaging it. That comes later. First step is this. Now, you're going to hold it for like a minute or two, like you would with the cheek slack thing that we did. You're gathering up all that tissue and bringing it up towards the cheekbone. you'll notice that your jaw will start to like relax and close around your thumb. So make sure your thumb's in a proper position so that your teeth don't try to bite it or some people have really tight space inside their mouth, I've noticed. I've been doing intraoral for like 10 years, almost 10 years. Yeah, like 11 years now I've been doing it. No, sorry, 9 years. 9 years. It's 2025, not 2027. Yeah. Anyways, so after a while, the decade is a blur. I can't believe I'm finally here doing this. Okay, so let's go back to that side that we worked on. Let's get our fingers back in that position. But instead of scooping up, we're gonna put our fingers on the outside. Yeah. Okay. And so it's a very gentle working the muscle. And since you got both sides of the steak here, so you're just gonna tenderize the steak gently. Okay. You can do it just a little bit or however long you need to do it when you're actually doing it. But already I feel a lot better on that side. And strangely enough, I feel like my teeth aren't scraping against my cheek as much. So when these get tight and start to lock down, at least for me, I tend to spasm more and I bite myself more. And that's because of the muscles in your back there that let your jaw go from side to side. So not only are we getting the two jaw muscles while we're doing that, we're also working around the lateral and medial pterygoids, which are also some of the biggest assholes in the jaw ecosystem. Okay, so let's come up to this side. All right. Ow. Oh, I'm really sore back there. You can also grab the tissue before the bone of the jaw joint. You'll feel it with your thumb. You feel the edge of that hard cartilage thing, but you'll feel like there's like a little lip of muscle that you can grab. And you can just do this. Can look at it. I got it. You might want to wiggle it slower than that though. That's an interesting one. I learn something new every time I do these techniques. Like I just deepen my understanding of the anatomy.
I missed something. Can you say it again?
My Alexa is going off. What the hell?
Sorry, I don't have an answer for that.
Of course you don't. You can also grab that lip of muscle and then you can squeeze it, like compress it, and then let go, and then compress it, and then let go. I would do it in like 3-second bursts. It's extremely tender on that side. Let me see. I wouldn't do it very, very hard at all. This side was definitely more angry than this side when it came to the muscles. The joint on this side was more angry than this joint. That's what I noticed. But now my upper lip loosened up. My nose is loosening up. Okay, so those are the things that you would do with like these fingers. Okay. Now for the next one, it's so it's always the opposite side, right? Now, I think I always struggle with this one just because of the angle, but it's a really important spot. So let me figure it out again. Okay, yeah. And then okay, we'll do this side first because this side doesn't hurt like a bitch and a half. So a hair. So what you're doing is you're taking that pinky and you're just putting it into the hinge. Ah, you're just applying a little bit of pressure up against into the hinge. You see that kind of like that split in the middle? Part of your nerve is there. That's where the dentist puts the shot to numb up your entire fucking side of your face. Then we're putting the tip of our pinky in that split to just kind of give it a little bit of feedback. And then we're hooking up just a little bit if we can. You may or may not find that useful. I find it pretty useful because there's a lot of tension back there. How are you doing with that one?
Definitely feels weird.
Yeah. How is your jaw loosening?
Um, a lot more than it was earlier, which is nice.
Yeah. And also too, when it's like really painful through there, if like touching it is just like, oh, I don't know if I should be touching this, it really, really hurts. That's where that ice cube or that little chip of ice would become useful. Okay, and so the next one, I forgot my gauze. I'll explain it to you why it matters. And then if you find gauze, you could do this. But you take like a little piece of gauze and you grab your tongue with it, and then you pull your tongue out a little bit to get like a little stretch for like 3 to 5 seconds, and then let your tongue go back and then do it again. 3 to 5 seconds, do it again for 3 to 5 seconds. It'll help release the tension here at the root of the tongue. and it'll help your tongue move. If you're because sometimes people's tongues get stiff, and when a tongue is stiff, it feels different than when your shoulder muscle is stiff. But when a tongue is stiff, like mine is stiff right now, impacts speech. You bite yourself more, and your tongue is just tired. The other way to stretch your tongue is to do this. Might force you to yawn when you do that. That's fine. But basically, what cats do, we can do. You ever seen a cat yawn and they go, and so that's one way that you can do it. It's always a little painful on me when I stretch my tongue because I'm a very stiff tongue. I have tongue ties. I'm not harming myself by doing it, but if it hurts, be more gentle with it. The next part is to release these muscles under here that attach to here. And the way that we do that is we can use our ring finger. So it's like you have two sections on the bottom of your mouth. You're just trying to gently squeeze the tissue between these fingers. Now, it's a hard move for me to do. If you have longer fingers, it might be better, but you're just gently squeezing it briefly. We're not trying to like get in there and really grind it. And then the outside technique version of that is like when you're putting lotion on your face, how you can go, under your jaw with the lotion a little bit. So if you think of this as the middle line, right? And you have like these two little triangles, this right here, close to the midline, this is okay to gently massage with your finger. But then you can also like do things like come up underneath with your thumb and gently stroke it as well, just to give you some insight as to that. And then this other inside of mouth technique uses your thumb. So I have a high and narrow palate. And I stick my thumb up into my palate behind my front teeth. And all I'm doing is just gently putting some traction on that hard palate. You'll feel a little bit of a pull. Should be slight. And I do it for like 5 seconds and then I pull back. Like that. Now that was irritating to me. I don't know why. Usually it's really good, but my palatine nerve was like, what the hell are you doing? So be mindful that when you do stuff like that, you might wake up some other stuff. Maybe your gums don't like it or whatever, but I've found it very helpful, especially when I had nerve pain around my nose. I felt like somebody had punched me in my nose every day for the trigeminal nerve. And it might wake up other branches of the trigeminal nerve too. Like now I feel my forehead lighting up. Actually, I had a headache yesterday. I had a cannabis hangover for for over 12 hours. That's the other thing too, is so Well, before I get into that part of the conversation, do we want to review any of the inside mouth techniques? Okay. So every time I do these classes are different because there's different stuff that comes up. But I figured I could also talk a little bit more about headache dynamics. So headaches can be caused from different things. They can be caused from stress, strain, injuries. Overusing your shoulder can even cause it because of the muscles that attach. You could sleep wrong, and because your spine was in a compressed state or it was in at its end range when you're sleeping, like say you fell asleep like this, that's not uncommon to cause a stiff headache, you know? Or you wake up and you turn your head and like, oh, fuck, can't move, you know? And it's like really sharp and inflamed. That's another one that happens a lot. And then sometimes, because we're dehydrated or we don't have enough electrolytes, we get like a headache, pain here. Maybe you tried to eat 20 jawbreakers at the Jawbreaker Championship, and that really strained or irritated your jaw. Maybe you have a tooth pain or you have an infection in your gums that can cause pain around the jaw and in the head because of the nerves. Maybe you chewed on steak too hard, like trying to eat beef jerky and stuff can cause tension, stress, and pain. Maybe at night you snore like a lot and you grind your teeth constantly, and that can cause headaches. Perhaps you have a mild irritation in near one of your cervical nerve roots that is causing some referral pain. Perhaps you have pain coming from pressure that's on your head from things that you have to wear. So like a helmet, or maybe the head straps are bothering you. Light can cause headaches. Like every time I teach a class, obviously the benefits of teaching a class outweigh the negatives, but my ring light starts causing me a headache for some photosensitivity in my eyes, which my techniques can calm that down, thankfully. Ear infections can cause headaches. Upper back pain can cause headaches. Playing video games for too long can cause headaches. Repetitive motion at the upper cervical can cause headaches. Alcohol can cause headaches. Histamine reactions can cause headaches. Mast cell activation can cause headaches. Noxious fumes and odors is a part of that as well. And then we also get headaches because we get sick. Or we have even blood sugar fluctuations can cause headaches. And then cannabis can cause headaches, cannabis hangover. So I had this gnarly experience where I used a pinprick of lotion. I mean, let me I'm gonna show you how much was on my finger. This is bonkers. Absolute bonkers. It was like this much. This is non-medicated lotion. Okay? It was this much from this product. Okay, now I understand that it's 3 times bioavailable. I did not know that. Nano-emulsified meant that it would be that systemic. I usually get the Salvation 1-to-1 cream, which is what I recommend people use. I actually have found the transdermal 1-to-1 cream for Nectarcraft. When I had my neck injury and it was giving me a lot of nerve pain, I would take a bunch of that and slather it on the back of my neck, and I would make sure to get it up into here. and it would take away my pain for about 4 hours. Then I'd have to apply it again. And I had to take that through TSA every time I went to work at the airport. I was doing massage there. And they pulled me aside a couple times to make sure it was exactly a 4.3 ounce fucking container. Like, I don't know. They really needed to always check my bags because I had that cream. And using something like this, I only got it because I can't find the Salvation cream, which is a different cream, which I would also be able to put on my neck. And that was a 1-to-1. And it's like not as strong, like it's like 75 or 300 or something in the entire container. So the other thing that I did not do, so if you're going to use cannabis topicals for pain, let me just give you my spiel. This is an upside down bottle. I think things travel. I don't have enough. I haven't confirmed this, but this is just what I think is that the fucking good chemicals travel down. And when I got that little pinprick, I gave myself a dose because I didn't shake the fucking bottle up. Right. And it's stored upside down. Now, there's not like a lot to shake. I can get a little bit of movement in here. So that's kind of concerning. But look at how much is inside. Now, I had a pretty decent time on it after my mast cells realized everything was okay. So I put a little bit on my ankle and I forgot that I had done it. And it was already starting to kick in and make me high. And I wasn't quite aware of it, but I did notice that all of a sudden I couldn't remember couldn't remember why I was in my bedroom or what I was doing. And I felt like a shift in my nervous system all of a sudden. And I was like, okay. And then all of a sudden, the switch flipped and I felt my mast cells activate and I had like a little bit of anxiety and my heart rate started to climb up and I felt a very familiar loading of my receptors with THC. And I was like, what the fuck? And then I remembered that this has a balanced terpene profile. And the balanced terpene profile and the CBD, the CBG, and the CBN, those are slower to load your receptors. THC loads your receptors pretty quickly in my experience. And so I was like, okay, I'm going to be fine. I'm just going to get busy doing stuff because now I'm stimulated. Right? Now there's myrcene in this and pinene. And those are indica terpenes. But this didn't make me sleepy. I mean, it gave me a little bit of energy, but it didn't destroy my night. But I wasn't going to go to sleep on it because I was activated for like about 2 hours. So it delayed my sleep by 2 hours. But it systemically numbed all of my pain. I stubbed my toes on a box of masks on the floor. I have 2 cases right now on the floor. And I felt the shockwave go through my bones and I felt it go up my leg. So it hurt because I jammed 3 of my toenails into the box at the same time. And I was mentally prepared to have to I don't know, push through that pain. But it dulled my pain before I could really register it. And that's how I knew that I was systemically high, that it wasn't just in my brain. And it was actually quite lovely, all things considered. But the next day I woke up and I had a headache, to bring it back to what we're talking about. And I felt the headache inside my brain. And I did have some cranial nerve irritation. So my face was a little tense and I had some tension from that. But I had if you took an alcohol hangover and you reduced it by like 70%, that's what my hangover was. And I even took a nap. I don't usually nap. I took a nap. I drank electrolytes. It seemed that my headache improved after meals. And I made sure to eat extra healthy that day. I had like a good salad and stuff like that, vegetables, vitamin C. But then it would come back off and on, just this headache that felt like my brain was throbbing. Now, I have had really intense THC highs before that made me extremely paranoid or have a panic attack. And this was going to almost do it, but I think because of the terpene profile, it didn't do that. And I think it was a low dose, all things considered, and I hadn't used cannabis in a long time. But I remembered I was in the bathroom and my towels were trying to breathe at me. And I was like, this is like mushrooms. What the hell? Like my towels were trying to breathe at me, and I could notice every single fiber in my towels. So I turned the colored lights on in my room, and that was really fun and amazing. And then I changed colors a little bit. I was like, ooh, that color is even better and amazing. And then my wall, I have like these like acoustic panels on my wall. They were like slightly popping out at me. Like I could just really see the 3 dimension. My eyesight was really sharp and clear, and all the pressure and pain was out of my eyes. I mean, I know why. Now I understand why glaucoma patients love this stuff. And you know, cannabis is one of the only topicals and one of the only medicines that I could use when I had my upper cervical injury and it started to give me all of these problems. Cannabis was the only thing that would reduce my pain. And then over time, I healed enough where the actual techniques that I taught in this class actually became more helpful. But in the beginning, they hurt me so much that they would give me a migraine for 3 days. I couldn't do intraoral. I had to use cannabis cream and I had to ice the inside of my mouth. And I had to do like really, really gentle cranial sacral type stuff. I saw a cranial sacral therapist for a while to help me. And then I had to go through strategic approaches for my upper cervical by seeing 2 of the other massage therapists that I know, one of which I've received this training from. So, yeah, I learn new things about my body and pain all the time and how to manage it. And so I just wanted to share that little bit with you because it was relevant and it's actually fucking hilarious. Now, today I'm not hungover. Thankfully, I was kind of worried it would last more than a day just because that feeling of my brain, like either being shrunken or throbbing, like that was a very interesting sensation. I have never had that before, and I have had like overdoses on cannabis that had like completely like wiped me out or even sent me to the emergency room. So I never had a headache like that. So I just wanted to share that piece because that was something. So not all cannabis topicals are created equal. If you're going to use cannabis topicals for your neck pain, ensure that you look at the ingredients carefully. If it says something like it's nano emulsified, then I suppose expect that you'll get high. But there are some transdermal creams or other creams that are not labeled as transdermal or nano emulsified. They won't really get you high. You'll get like a little bit of a body buzz, but it'll be something that you can ignore and then you just notice your pain goes away. I find that the Salvation 101 cream is that. And that's a very gentle but effective one. The Nectarcraft Transdermal 101 cream, if they're still making it. And then the Flow Gel, that stuff, those are all good. This is like kick your ass and take names and chew bubble gum, ask questions later. But the actual experience of the high was actually, all things considered, quite pleasant. And it is very effective. So I thought I would bring this to the clinic and offer it for people to use for spot treatment. I'm not so sure now. Unless they're a heavy stoner, perhaps that would be fine if I knew that they were already have a tolerance, but I had zero tolerance going into that. And I had a trip. I mean, it's true. THC can cause a trip psychedelic like experience. And I tend to like lower dose stuff. So, okay. So we covered that. We covered topicals. We covered self-care toys. We covered inside mouth techniques, outside mouth techniques. Gosh, we're only an hour into the class. Oh yeah. Yeah, so the light sensitivity stuff, you need to like not have you need to exit the light sensitivity. So, sorry, leave the place where it's bright. Shield your eyes, sunglasses, right? We all know that. But when you're able to do something about it, you know, that this technique where we bring our eyebrows together is a helpful one. So pretty much you would do that stuff around your eyes. You can also go down here and find that and push it up under your eye to help with that. The cold pack mask that goes around your eyes with the holes or even without the holes, that is great for eye strain, photosensitivity, headaches. That will be really great. Wear it for 5 to 10 minutes, lay down in a dark room. So a lot of migraine stuff too causes photosensitivity, and that's also what you would do for that. You can put a wet, cold compress, so you can get like a washcloth, get it wet, wring it out really well, shove it in the fridge if you don't have one of these, or if it's just really cold out and your pipe water is icy cold, do that, wring it out really well, fold it up so it's a little thick, and lay it across your forehead and have it go on your temples. Make sure it's not frozen. You don't want it to be that cold because you have a blood vessel that runs through here, right? But you just want it to be cold, cool, and put it on your forehead and then just like lay down and rest. And then you can take it off anytime. Because it's cold water, it'll start to warm up, so it shouldn't cause problems. But if it's really intense for you and you've already done it for like a couple minutes, take it off, take a break, try it again later. Yeah, that's what you would do for the light sensitivity. Do you have any other like random questions like that that I can answer? Okay, and then I think the last thing that I'll say on this is that good attempts at oral hygiene will reduce pain because gum pain radiates. I have a lot of gum pain. I have trigeminal neuralgia basically. Like I'm extremely sensitive. Since I hurt my neck, my nerves are angry and it's taken years. I was injured in November of 2017. So we're in the second half of a decade after my injury. And that's why I teach this material because it was very difficult for me to find the right people to help me. And I was very lucky that I already had my mentor. But in the beginning, he was cost prohibitive to me. So I tried to see people who were cheaper who trained under him, and they gave me migraines. And then I realized I needed to see a craniosacral therapist. So I did that for a while when she was building up her business because she was less expensive. And then I had to end up going back to my mentor a lot because I was still having problems. And I'm very grateful to have had those connections because if I did not have them, I don't know what I would have done. The pain that we can experience from headaches and migraines can be quite severe. Just like when people who have uteruses, our pain can be quite severe as well. And painkillers, opioids, over-the-counter medications, they're not great long-term solutions for many reasons. My biggest problem, I'll get to your question in a second. My biggest problem with over-the-counter non-inflammatory medications that you can buy is that they can tear up your stomach and they can cause long-term issues if you take them enough. Case in point, my mom was taking ibuprofen multiple times a day because she was in a lot of pain, and I'd imagine that some of her pain was due to mast cell activation issues that are undiagnosed, because I was starting to have the same problem where I had widespread pain. I was waking up 7 out of 10. And eventually she developed swelling in her ankles and had to be put on diuretics. I think short-term use over-the-counter medications are fine, but trying to drop inflammation levels with that over and over doesn't address the root cause of the inflammation. And when we can use these slack techniques in the interim, that is a great opportunity to reduce our dependency on medication if it's possible for us and if that's what we want to do. So headache relief for PMS. Well, that really depends on the nature of the PMS. So this is what I know. There's a hormone drop on or after the first day your flow starts. And as you get older, in my personal experience, that hormone drop gets worse. The headache gets worse. The brain fog gets worse. It makes you want to sleep in longer. Maybe you need to take a nap. Ice on the back of your neck can help. And then ensuring that you have proper nutrition, ensuring that you're addressing histamine issues. So if you have a mast cell problem, make sure that you're taking your medication, whatever that might be. I actually was without vitamin D and CoQ10, which I have to take. Based on my 3x4 genetic test results, I take supplements that are tailored specifically for my genetics, that's scientifically backed. And that's why the only genetic test that I recommend is 3x4 genetics, because it's something that you can do if you have money. It's actually more affordable than some of the other genetic tests. It's something that you can get over the counter. You do the swab, you mail it in, you get your results back. So vitamin D3 is like a hormone in your body, and CoQ10, coenzyme Q10, ubiquinol or ubiquinol, that's a heart enzyme that helps with keeping your blood pressure and your heart rate regulated. And you produce less of that enzyme as you get older. And I was without those for some time, and my period was actually really bad. And I had neuropsychiatric symptoms from the histamine buildup that we produce when we were getting ready to start our flow. And the first day of my period came and I was finally able to get back on my supplements around that time. And I had also taken my regular dose of vitamin B12 that I have to take, a specialized formula for my particular issues. And I remember sitting there with a heated rice bag on my belly, pushing it into myself, like pushing it into my belly to stop the cramping and stop the pain. And after about an hour or so, everything kicked in and it stopped. My cramping slowed down and the pain almost went completely away. And when I looked it up and I looked at the research and I looked at what these supplements affect, it's inflammation. So with the vitamin B12, helps to lower homeocysteine levels in the body. The coenzyme Q10 helps with inflammation. And then vitamin D3 and omega-3s also help with inflammation, and they help with immune response. And it killed a lot of my pain from my menstrual cycle. So ensuring that you have the right nutrition, the right supplements, that you understand the core cause of your PMS or menstrual pain. So, for example, I'm pretty sure I don't have endometriosis, but if you have endometriosis, then that's a bit different than dealing with something like PMDD, which I have the symptoms of. And the symptoms of PMDD for me are coming from histamine intolerance and mast cell activation, as well as a vitamin B12 issue. So it can be quite complex. But ice or a cold pack on the back of your neck can be very helpful. That cold pack across your head, making sure that you take your electrolytes if you feel that you need them, that you are hydrating, and that you are eating full, complete meals with enough protein. Now, those are things that if you want health coaching around, I can do one-on-one sessions. We can talk about that. We can go through your medical history and I can give you more specific things to tailor for that. But those are like basically the principles of it. And I think too, for like trans men who still have like a ghost period, some of those would apply as well. Okay. We have any other questions or discussion points before I wrap this up? No? Okay. Well, this was the fastest class I've ever done. I'll send this to you. I'll get it to you.